In this slide, we will talk about indicator dilution method based on rapid injection, the second type of indicator dilution methods. The continuous infusion method has been largely replaced by the rapid injection method, which is more convenient. A bolus known amount of a substance such as a dye or radioactive isotope of indicator is rapidly injected into the vessel venous, and the variation in downstream concentration of the indicator, the arterial concentration, versus time is measured until the bolus has completely passed through given volume, as you can see in this figure. After the bolus is injected at time A, there is a transportation delay before the concentration begins rising at time B, After the peak is passed, here is the peak, the curve enters an exponential decay region between C and D, which would continue decay along the dotted curve to T1 if there are no recirculation. Suppose that we have a river. In a river, we don't have any recirculation. We have a one direction of flow, and therefore all the particles or the indicators will be completely pass in a one direction path, and therefore we don't have any recirculation. But in our cardiovascular system, we have a specific determined recirculation of blood. However, this recirculation causes a second peak. If we have recirculation here, we have a second peak at E, as you can see here in this situation. Before the indicator becomes truly mixed in the blood at F. After some pulses, the indicator becomes truly mixed in the blood, and we assume that point is F. Also, we have another chart. We have another chart, dashed line chart. The dashed curve indicates the rapid recirculation that occurs when there is a hole between the left and right side of the heart. For example, ASD, atrial septal defect, may lead to this abnormal dash curve with a rapid recirculation. And ASD is a heart condition that means that it's uh, congenital heart defect. People with an ASD have a hole between the upper heart chambers, and this hole increases the amount of blood going through the lungs also. In rapid injection indicator dilution method, we don't have any continuous injection. Therefore, the equations related to this method, to this type of method of dilution, um, is different. As you can see here, an increment of blood of volume, delta V, passes the sampling site in a specific time, delta T. Therefore, in rapid injection, we should consider that we have a limited time, and we should use a time-related equations. The quantity of indicator dm contains in dV is the concentration Ct. And therefore, we can rewrite this equation, this time-related equation of concentration and the quantity of mass and also the volume value, and by dividing two sides of this equation by dt, we have an equation like this. dm equals ct dv, and by dividing by dt, dm divided by dt equals ct dv divided by dt. dv divided by dt is f. Therefore, we can rewrite the equation with this one. dm equals f multiplied by c multiplied by dt. Okay, we have a differential equation. Therefore, we can calculate the integration of this equation to find the m. If we calculate the equation, the integration of this equation, we have this equation. M equals the integral of f multiplied by ct and dt. Okay, and also, as you can see, we have a limit time, and the integration will be calculated in this limited time. This time is the time at which all effects of the first pass of the bolus have died out. Point E in figure 8.2 from the book. Also, the mixing of the bolus and the blood within the heart chambers and the lungs smooths out minor vibration in the instantaneous flow Fi produced by the heartbeat. Thus, we can obtain the average flow F from this equation. We assume that the Fi is not related to time, and is average value. Therefore, we can bring this parameter out from the integral, and now we have a equation. We have an equation here to find the flow rate from the bolus mass, and also the integration of the integral of the CT dt. If the initial concentration of indicator is not zero, as may be the case when there is residual indicator left over from the previous injection, then becomes this equation. This is the final equation. We will use it because we may, in some situation, we have a non-zero value of C at the start of the calculation. Therefore, we should use the delta CT instead of using CT. Another type of rapid injection indicator dilution method is dye dilution. This method is a common method of clinically measuring cardiac output based on some colored dye. For example, indocyanine green or cardiac green is a common material used in this dye dilution rapid injection method. This material, it meets the necessary requirement for an indicator in that it is inert, harmless, measurable, economic, and always intravascular. Intravascular means that it tends to stay inside the vessel with minimum absorption into adjacent tissues. In addition, in optical absorption, peak is 805 nanometers, the wavelength at which the optical absorption coefficient of blood is independent of oxygenation. The dye is available as a liquid that is diluted in isotonic saline and injected directly through a catheter, usually into the pulmonary artery. About 50% of the dye is excreted by the kidneys in the first 10 minutes, so repeat determination are possible. The plot of the curve for concentration versus time is obtained from a constant flow pump, which draws flow from a catheter placed in the femoral or brachial artery, and also blood is drawn through a calorimeter cuvette, which continuously measures the concentration of dye using the principle of absorption photometry. We discuss about this procedure at the next slide. As you can see, we have a simplified integrated system. The sample will be placed inside our measuring system. We have a light sensor here and also the bulb, for example, an LED, and also the other light source here, a filter to detect the to select the specific bandwidth for the color, and also a cover to cover the cuvette to prevent the entrance of the light. We have a curve like this, and based on this curve we can measure the variation and the time. We can find the time of our calculation. We know the amount of dye or the mass value of the dye, and also the variation of the concentration and time, and in the integration of this part. And now we can calculate the average flow of the blood inside the system. Thermodilution is the most common method of measuring cardiac output. Is that of injection bolus of cold saline as an indicator. Cold saline as an indicator. This is I think this is the simplest way to have an indicator. In this system for thermodilution, a special 4-lumen catheter is floated through the brachial vein into place in the pulmonary artery. A swing forces a gas through 1 lumen. The gas inflates a small donut-shaped balloon at the tip, and this donut-shaped balloon helps to moving the catheter inside the vessel. The force of the flowing blood carries the tip into the pulmonary artery. The cooled saline indicator is injected through the second lumen into the right atrium. The indicator is mixed with blood in the right ventricle. The resulting drop in temperature of blood is detected by a thermistor located near the catheter tip in the pulmonary artery. The third lumen carries the thermistor wires used to measure the temperature and the variation of temperature inside the vessel. And the fourth lumen is not used for measurement of thermodilution, can be used to withdrawing blood samples. In this method, an artery puncture is not needed, and therefore it's more safer than the other one. In thermodilution, we have a simplified equation to calculate the average flow. As you can see, a bolus of chilled saline solution is injected into the blood circulation system, right atrium, and in this case, this cause decreases in the pulmonary artery temperature, and we can use this equation to measure the average flow. Q is the heat content of injection, or the heat content of injectate. Rho B is the density of blood, Cb specific heat of blood, and a specific heat of blood is a known value, and also the temperature variation is delta Tb, and we should be aware about the time T1. Several measurements can be done in relatively short time. A standard technique for measuring cardiac output in critically ill patients, and also this method as a good method, but have some problems. There may be inadequate mixing between the injection site and the sampling site. Also, there may be an exchange of heat between the blood and the walls of the heart chamber, and there is heat exchange through the catheter wall before, during, and after injection. However, the instrument can be calibrated by simultaneously performing dye dilution determination and applying a correction factor that corrects for several of errors.